When I was at Partnership with Patients in Kansas City last time, I gave a similar talk. This one is Give a Damn About Implants. And again, it's data about me. But as it relates to medical devices, I'm really, really grateful to Regina for her introduction to me. And to the sponsors, I'm a scholarship patient here this time. I came from Texas. And I really appreciate it, as all of you know, that patient advocacy doesn't pay well. So it's really nice to be supported to be here. Let's see, the data about me relating to devices is a little bit different. When somebody goes in to get a hip or a knee implant or similar things, oftentimes there is some time to think about it. It's not always an emergency. So patients have a great amount of difficulty getting information, both the numerator and the denominator of any kind of device, if they can even find information about the specific device that's being recommended. The denominator would be how many implants have been done this year, ever, that kind of information. And the numerator is, well, how long did it last? How many people are still surviving? How long did they survive? We can't find that information easily, and that's really critical to informed consent, but we're not getting that information. My logo, I designed it, and when Kim Martin was talking about being more business-like and showing return on investment and everything, when I went to the FDA after my brother's implant failed, they invited me to become a patient representative. I was very excited. We spent 3 days with all these other patient representatives and other people being trained at the FDA, and it was a wonderful experience, but I learned information that made me less excited about being on the device side of it. The pharmaceutical representatives actually were invited onto the panels, and they voted. It's very rare for anybody like me trained in on the device side to even be invited, because these things don't go onto a panel. They go through 510K, which is just a clearance process. But when I was at the training, when I found that out that I wouldn't be showing up very often, oh, and the other problem was that you get selected, even after you're trained, you only get selected by the Office of Special Health Issues. And then I learned how much industry conflict of interest there is at the FDA. The industry does not want me speaking. So I wasn't going to be invited. It was pretty clear. And I said, well, where can I go where I can be heard by the FDA? And they said, well, there are 2 town hall meetings. And that's how I met Hugo Campos, because we spoke at the same town hall meeting in California. So I had to pay my way to California from Texas and I had 3 minutes to speak. Okay, that's how much they wanted to hear what we had to say. And on the shuttle on the way back to the airport, there were 2 young things, darling young women, cute as can be, saying, wasn't it awful how the patients co-opted the meeting? And I turned around and I went, oh, I think I recognize you from being in the same meeting I was in. Do you not realize that was a town hall meeting? You know, we're supposed to be able to speak there. So
what did they say?
They said, wasn't it awful how the patients
what did they say to what you said?
They were a little bit embarrassed. They didn't really want to speak to me after that. And I asked them why they were there. And they were both pharmaceutical reps. One of them was unemployed and was trying to network while she was there. And I'm sure it worked wonderfully for them. Yes, cheerleaders. So anyway, so my logo, I was told even with that I also went to a meeting that was supposed to be about setting fees for the medical device industry to the FDA. And I got invited. I flew there in January on my own money, $1,700 to get there because it was last minute, for a 2-hour meeting. And there was a tent on the table that said my name on it, and I sat down. I was a little bit early. 5 people surrounded me from the FDA, and they said, "I'm sorry, but we discovered you don't represent an organization." And I said, "I never represented myself as representing any organization." But they said, "I'm sorry, you're going to have to be pulled to the side." So I didn't have a microphone in front of me. I didn't get to participate, and nobody ever returned my $1,700 that And then they said, "Please don't tell anybody. I don't want you to say that you're a FDA-trained patient representative. You have to say that you were trained. You went to patient representative training at the FDA." So anyway, so I started getting more business-like. I have my business cards if anybody wants them. Pass those around. There we go. And I designed my own logo, and I, on purpose, put FDA in it with the little I. And the circle is to show, they say that, patients are involved in the lifetime of, of the design of the program. Oh, no, they're not. They do human factors testing, which doesn't have a single patient in it. They talk about patient preferences. We don't have preferences. We want it to be safe and effective. It's not like I want the purple one, not the pink one. So it's really lame, and it's really insulting, the kinds of language that they attribute to us as patients and patient advocates. And I also wear this yellow dress. This is kind of my thing now, yellow. And it's to wake people up, really want you to be awake. It's not all, bad news and everything. We do need implants. But it's also a caution. There are plenty of failed implanted devices. So, and then I wanted to let you know, I'm going to share a couple of things with you guys. This came from Consumers Union, and I stood out in the cold for 3 days in New Orleans last March at the American Association of Orthopedic Surgeons, and we wore this. It was a group of us. They let us stay out in the rain for 3 days in the cold and barely would talk to us. And the one company that was the largest sponsor, Zimmer, absorbed the one company that had a warranty, Biomet. So now there's no warranties on anything. So
yeah. There are in Western Europe, not
thank
here.
you for that. You say yeah.
Yeah. No, I mean, I knew that. I've written about that.
Now, what I do with these shirts is I give them away. I hand them out. I'll put them on my desk chair. I'll put them on the back of one of my seats in my car, so somebody will say, "Oh, what is that?" And I put it on my roller bag when I'm coming to and from a conference. So people notice, the Uber drivers noticed this one when I was in San Francisco, and the Uber driver's sister had just got an e-sure. So this is a really sweet shirt. I'll show you something later that's not quite as sweet.
What's on the front? I can't see
It says e-sure problems, and I'll be talking about that in just a few minutes. So anybody know anybody that has e-sure? Okay.
what it is.
Good. Okay. Well, we'll leave it up here, and if anybody wants to come and take this shirt and introduce, somebody to e-sure, it's yours. Yes.
You just said, just kind of maybe stop in my tracks. You said they let us stand out in the rain for 3 days. Can you help us understand that? 'Cause that just
Convention Center, this was an international conference of orthopedic surgeons. They had about 30,000 of them. They knew we were there. I was with Consumers Union, Safe Patient Project, large group of us. We had applied to be a part of the conference. We applied to be a panel, to even have the opportunity to talk to somebody, and they refused it all. And we were ready to pay to get in, and they refused us. This is not that unusual. I've heard of several people being able to apply to be like media. I'm a blogger. They rejected me as a blogger even. I tried it at another conference I'll tell you about too.
Well, also, you went wrong about the let you, because if you're outside on the street, depending on property line stuff, let you means that they could have called the cops to have them, so
But we were on public sidewalk.
you are a public.
But they wouldn't let you come in and use the bathroom. You couldn't get any food. You were stuck outside in the rain, and they knew it, and they were cool with that.
Did you apply to present a paper or something?
Yes,
Yeah.
You did?
yes,
Yeah, yeah.
Okay.
yeah. They did not want us in there. If I don't mention it again, implants, if you can get your head around this, the medical device is an industry. But the industry is fairly supported by two other industries that are really huge, metals and petrochemicals, plastics. Okay, so just keep that in mind as I'm going through this. Let's see. I know there we go. Okay, so this is me, and this is my brother Stephen. He's from Minnesota. That's where I grew up, but I live in Texas. Okay? We're both adults. We weren't like corresponding every week or anything before all of this happened. He has a family of 2 children. I have 2 children. You know, we're busy. So anyway, when this happened, he was hurt in 2001 on the job. He's a millwright. Does heavy labor outside, and he was kind of the go-to guy, built the Mall of America, you know, skyscrapers there and everything. So when this happened, it was an accident that was actually caused and was a criminal case because the other worker was negligent and put my brother in this situation. So there was a lawsuit about that, and it went through, and Stephen got paid off for that, but it really doesn't cover the medical costs that he has gone through. So I had a chance to see the real trauma of his family going through this. He had 12 different 9 operations in 9 years, and that was the pins and the screws and things like that, and then they'd loosen and he'd have to go back in, and he had good relationships with his doctors. You know, it was a bad situation, but he always had a good relationship with them. And finally, when it got loose, and Stephen could see sort of this was going to be the end of his career because he couldn't keep doing this, going back to work and, you know, having surgery and going back and forth. So the doctor said, they're doing something down at the Rochester Mayo Clinic. My dad was an administrator. We lived in Rochester as I was growing up. Knew it very well, really respect the Mayo Clinic. So it was pretty easy. I checked out the doctor and checked out everything that he was doing online. And we decided this would probably made sense. And so Stephen went into the operation, I think it was like May 2008, and by September, 4 months later, he was having a revision surgery, which was new terminology for us too. And the doctor said, well, I'm just going to put this back together. There's like a ball in a socket, and we'll put it back together again. And what happened was he took out the ball. I don't know if you noticed what was in your pocket last night. You did the walking gallery jacket. Did you notice in the pocket? I meant to bring it. You can see the piece that they took out of my brother's arm that connected. You know, there's like a piece that goes in here and a piece that goes in here, and then there's like 2 looser pieces that kind of move together, the ball and socket. He took it out, so my brother's arm now is like loose. And that was the revision. And so he's living with this metal in Minnesota in his arm, not connected and in pain. So I began lobbying Congress in 2009 with Alliance for Justice. They were also doing similar work. And let's see. And then I joined Consumers Union's Safe Patient Project in 2010, and they are fantastic. They have convened me like this is a convening group of other patient advocates. I've learned so much that we're all connected. What we're doing here, all connected. And then I went to the patient representative training. So this was Regina's jacket that Kirk wore last night. And it really shows very graphically what's happening. That's the piece that was removed from his arm. And his arm does look like a zipper now. And he's in pain. And the other thing, somebody saw this and they said, "You look so angry." And I took that, you know, I was like, you know, I don't want to really act or behave like an angry person. And I did some more reading about anger. This is not anger, what you see on our faces. Do you know what this is? Righteous indignation. And that's for a justice that you have not found. So, thank you. So he's living in pain and poverty, and I get to watch his children suffer. They're now young people, and they both had children out of wedlock and married too early, but they're doing fine, you know, have jobs that they probably, you You know, they had to take because they didn't get through college because he couldn't support them. Very frustrating to watch this happen to a family member. The way I got started was after his revision surgery. Actually, before his revision surgery, I was the one that called the doctor and said, there's something wrong with his arm. I can tell it in his voice. I talked to him one day, and I said, he doesn't even sound like himself. And he told me that his arm was purple and blue and doesn't look like he's getting any circulation. And the doctor said, well, you know, tell him to come on back. And I said, well, you know, he's up in northern Minnesota and you're in southern Minnesota. Like, when he shows up, are you going to be ready for him in the emergency room? But that was the last time the doctor would ever talk to me, even though I became my brother's power of attorney and everything else. So the Mayo Clinic, when we started asking questions about what's in his arm, you know, who made it, what does it look like, can you show me one? You know, because my brother is mechanically inclined. He really wanted to know, how does this thing work? You know, like, why isn't it working? We asked too many questions. The Mayo Clinic sent him a letter saying, all we'll provide for you is federally mandated emergency care. And he's on maximum dose opioids, probably for the rest of his life, for his pain. This is what his mouth looks like, and he's so embarrassed for me to show you this. This is one of the unanticipated consequences of a failed implanted medical device if you're in pain. If you have to start taking things like hydrocodone, this is made by Abbott Laboratories. I called them up and asked them, is this like an adverse event, you know, for, You heard the dentist yesterday talking about dry mouth. This was dry mouth from the hydrocodone. He would sleep and wake up in the morning and his teeth would be crumbled and gone. And when this happens, the harm escalates over time. I can't understand him on the telephone anymore. His diet has changed. You know, the bacteria is just terrible. He's 4 years younger than I am. He's smarter than I am. He's in really bad pain. He's gained a lot of weight from the medication. So the purpose of implants, they're really good implants. I have an implant. I won't divulge what kind it is. Many people have implants, and it's fine. They're to reduce pain. They're to improve your function. If they do it, that is fantastic. This is what happens to the harmed patient. There is a protocol loop that keeps you going like the guinea pig that you are, okay? I call it the infinite protocol loop. It's hard to get a hold of your medical records. If you ask for your medical records, they assume you're going to be doing a lawsuit, okay? Just know that.
Today, if you went back and asked for them, but the new laws in place back to the right.
I did get the medical records, but they assume that we're doing a lawsuit. I think that's why we got the letter from Mayo Clinic saying he can't get any more care.
Yeah, no more care for you.
Yeah. You know, but you need that to identify the device and the manufacturer, and you should have that information. The other problem I had was defining a failed device, because when I called and I said, would you please report, you know, I figured out, FDA, you're supposed to report it. I asked the doctor, would you please report it as a failed device? He said, it's not a failed device. I was like, well, how do you define failed device? It is the Australian registry. I think it's in my slides later. The Australian registry says if it's a revision surgery, it's a failed device. It would be nice to know that here. And the doctors here don't have to report it to the FDA unless you die.
Yeah.
But there is a registry in the U.S., right?
Yeah.
Is this in Australia?
Oh, there's no registry here. Mayo Clinic says it has its own registry, but that's not even available.
That's proprietary to them.
It's proprietary to them, and sometimes even the people who put in information into the registry can't retrieve
Right.
the general information. So it really is proprietary to the Mayo Clinic. They're talking about having an American joint registry, but it's not going to include things like my brother's elbow. It's just going to be hips and knees and the people who decide they want to participate. And we won't, as patients, be able to retrieve that information before we have an implant to get that numerator denominator.
And also the thing about if you die from harm from the implant.
Prove it.
Exactly, no, but I mean, again, you have to prove it.
Yeah.
And, you know, I know my father's life was shortened because of a surgical error around a...
Yeah, and your orthopedic surgeon probably is not going to go, oh, he died and it was from the hip I put in, so I must go to the FDA and report. They're not going to do that.
No,
That's not going to happen. So anyway, the protocol loop is you're supposed to go to surgeon, patient affairs, which is their lawyers, hospital trustees who you can't get a hold of. If you go into the Mayo Clinic website, you cannot find out how do I contact the hospital trustees if I have a problem. Can't do it. State medical board. State medical board in Minnesota is the worst. Public Citizen came out with that information. They're protecting their doctors. State Attorney General goes, ooh, hands off, it's federal. Yes.
So Mayo Clinic is a nonprofit 501c3 organization. The assets are owned by the community. You're telling me that the board is shielded from public contact?
How does that work?
I had to do a registered certified letter and I never got an answer.
To the board chair, to a member of the board?
I addressed it to Dennis Cortez, who then was the CEO. Yeah. Okay, so, and then you go to the FDA, and the FDA goes, oh, yeah, well, we're collecting this information. Then you'd say, well, what about investigating it? Ka-thunk. And we had a letter to them as well. We had to do Freedom of Information Act to even find out if they had confirmed our report to the FDA. I had that, on my computer because I took a screenshot of it. But I said, I'd like to have a paper copy of it. And Freedom of Information said, we can't find your records. Just goes away. So Congress is the one that defines what the FDA is supposed to do. It gives its charter. And that charter is from 1976 for the devices, CDRH. So it's really old. And try and get a lawyer in Minnesota that will do anything against the Mayo Clinic. Good luck. So patient harm. This one is really was the most fascinating thing to me. Was you would be in a group of doctors and saying, I hurt and I'm frustrated and I can't get any help. No acknowledgement. I mean, it's like standing outside of that convention hall in New Orleans. They would just walk right around you. You become the problem. I mean, like you're the disease. So we are not in the risk-benefit ratio that FDA talks about with devices. The risk-benefit seems to be more the business risk benefit than it is the patient harm risk-benefit. My brother lost function in his arm. He lost his job. He's lost financially so much. He's lost real insurance. He's lost his medical care that we thought was so wonderful at the Mayo Clinic. He can't access that, and we will not because we don't trust them now. I think the majority of doctors at Mayo Clinic don't know that this has been done to our family. He's lost his family. He lost his wife because she just couldn't take it anymore. Just the pure craziness of this kind of pain. He's really lost his will. He's living, but it's really different. His civil rights are, I think, the biggest thing. I think from now on, in any kind of informed consent, they've got to tell implant patients, you are losing.
Have you tried going to the Office of Civil Rights at HHS since they...
No, I haven't, but I've kind of run out of money and interest in running after them anymore. They can come get me, okay? If you solve this problem, HHS, Congress, FDA, I'll go away. I'll stop doing this. Okay. I dare you. I would love it. Okay. The media is supported right now by all these direct-to-consumer ads. It makes people think that these implanted devices are wonderful, and it's fueling the power of the medical device industry. Yes?
So, Joleen, I've got to say, I hear you making a very strong case for how screwed your brother has been and everything, and I'm left wanting to eat cyanide, almost literally. Because, like, is there any hope? What do we take away from this other than good luck trying to get anybody to talk about this and good luck trying to get anybody to listen? Is there nothing but despair? Do we just go away?
We'll start ramping it back up here. Okay. You get it. Okay. So, oops, I'm going to go back one. This is one of the things that I would love to have more eyes on this. We are finding that there are some companies that are starting out Twitter links and things like that, Twitter things, encouraging people to start signing different petitions and things. The petitions may be just fine, but these companies are using it to start fishing for harmed people, and they're not always getting diverted to people who are actually going to help them. So if you hear of anything like that, please let me know, because I will go after them.
Is this a good guy or a bad guy?
This we're looking into right now. We think it's a bad guy. It's just started. You know, they say that they're doing, you know, helping these women, but we've never heard of them before. It's a place in Danville, California. So,
What do you think it is that's harmful that they might be doing?
I think what it is it's a consortium of lawyers who have hired a marketing company to put up this change.org thing, and then they'll see who signs it, and then they'll go fishing for their clients. But not all of these lawyers are actually working for the women. They're working for themselves, okay? So, patient engagement. This is one thing that, the other thing we need to do is hold our medical people, their feet to the fire. When they say they want patient engagement, look at me. Have I not been engaged for years now? Okay? I was like, okay, I'm engaged. Now what? Can we not help? This is all the materials that I've collected on my brother. I thought I was going to make a few phone calls while he was recovering, and I knew his arm was still hurting him, so that's how I became his patient advocate, and it's turned into, like, it's taking over a room. You know, I have to go to D.C. to get trained. This was in, oops, I'm trying to think of where this one was. I think this was Selling Sickness. This was in D.C. as well. But when you find a patient who is engaged or an advocate that's engaged, keep them engaged. I'm not a one-fer. Don't treat me like that. So, okay, this just came out, well, this is 2013. The DRGs are the diagnosis-related groups that CMS is paying for. Look at their payments. That's number one, major joint replacement. Can we not do some patient outcomes on these joint replacements? And it was only recently that, I don't have my notes on that, only recently that they changed the CR or the codes so that they could decipher between a revision and an original joint replacement. You need to have that information so you know how many are being replaced. And CMS is like the major one that's paying for these. Now, oh, this is not getting cheerier yet, but it will, trust me. There was a woman at Health 2.0 where I met Regina. Her name is Nora Iluri. She has been subsumed by Google. She produced this website called devicematters.com, and she sold it. It was her information that she sold to the medical device companies, and it was brilliant. But this, I think, shows you tested devices, okay? Of all the devices that were approved in each year, look how many actually, and that's called PMA, the pre-market, like clinical testing. Very few of the devices, most of them only get 510K approval, which means it's substantially equivalent. Like one fork is the same as another fork. Well, maybe not. One might have 5 tines and the other one has 2, you know.
It might be made of
Bigger, little.
plutonium.
Yeah, exactly. So they can be quite different, but they use that. It's called grandfathering. So Nora Iluri would be a great, great person to have on that technology group because she knows this stuff inside and out, but she got subsumed, and I can't afford her, you know? So JAMA also is showing this, that the high-risk devices that were recalled, and this is 2015, most of them were 510K. They didn't even have a clinical test. My brother's was a 510K grandfathered one. It was like another Mayo Clinic doctor. His name was Dr. Morey. He's still there. And Dr. Sean O'Driscoll that made the one that was in my brother's. He said, well, mine is just about like Dr. Morey's, and it got 510K'd in. Let's see. And then, So the other one is Diana Zuckerman from the National Center for Health Research in Washington, D.C., and she's been really wonderful about going to Congress and talking about this. The Institute of Medicine was commissioned by the FDA back in 2011 to look at the PMA, the clinical testing versus the 510K. And the Institute of Medicine, July 29th, 2011, came back and said, the current 510K process is flawed based on its legislative foundation. It has changed nothing, the fact that Institute of Medicine said this. FDA came out the next day and said, no, it's fine, we're good. They commissioned this, this thing. So what happens is the medical device companies want to get their new devices cleared as an innovation, and then they quickly, aggressively push these devices. It takes us a long time to figure out, is this working, is this not working, because nobody's really watching it. Meanwhile, they're making a huge profit. Because they've sold so many, they become the gold standard. I mean, without real value, but they become the gold standard. So then everybody thinks, well, I got to be using it because it's the gold standard, and they can start saying that to their patients. And they hire doctors who are influencers of other doctors. So it's just like the pharmacy industry. So let's see, Donald Gerhardt, the CEO of Life Science Alley, which is a very large industry lobby group, estimates that 55% of all of the med tech and life science companies in Minnesota are entirely dependent on selling 510K approved products. He said these firms directly employ about 18,000 Minnesotans. So if you're a harmed patient, you have to fight against people saying you're going to take jobs out of Minnesota. Yeah. Okay, this is another one. We began with a hip replacement and just sort of riffed off of that. This is kind of the off-label kind of device stuff that's going on as well. 3D printing, I know, is very exciting, but that will also add to our problems because if there's no real follow-up on did it work or did it not work, it's just throwing more stuff into people's bodies, and it's still going to be petrochemicals and metals that people are getting immune system disorders from and toxic metal in their system. So what we need to do is test the actual materials before we start doing all of this. And then research shows that older and less complicated devices most often work best. So the innovations aren't necessarily better, but they get marketed as being better. Okay, the conflict of interest and the public good and money, career, prestige. Doctors are doing, all of us are doing this all the time. You don't want to do harm to your community and public good, but you do want to earn some money and everything like that. So this is a quote from the Stanford University chairman of orthopedic surgery. And he says, you get a better chance of getting a letter from your car manufacturer if your car is recalled than you do if your hip has been recalled. So true. We need to change that. And the corporate incentive is to profit. We have to recognize who we are working with here. And the FDA industries of conflicts of interest are well documented and pervasive. That's where their money comes from, is from the industry, the fees from the industry. And the people within FDA rotate in and out. And I'm not saying everybody's evil at FDA, but you just have to recognize that's what's going on there. The joint registries are a silo. Okay, I won't beat the dead horse here. Okay, this is about Dupuy Johnson & Johnson. Executives placed the profits before patients with their dangerous metal on metal hips. There weren't any undergoing clinical trials. They have the highest failure rate of all the things in the New England. Yeah, New England, not New England. In England, they do have a joint registry. Yeah. So the Dupuys were like the worst. $3 billion for lawsuits. And believe me, you get into a court of law, this is not the place for a harmed person to be. Anyway, the Australian Orthopedic National Joint Registry, which is required of everybody, every joint is in this registry, showing the Dupuis Johnson & Johnson product failing at double the standard. You know how many of those metal-on-metal hips were put into people here in the United States? 500,000. So, I mean, when you talk about our national healthcare system and what we, share as taxpayers in helping people who have been harmed as deeply as I explained what happened to my husband, my brother and his family, the harm goes through the generations. We're supporting those people. So wouldn't it be smarter for us to be preventing the harm and following these outcomes so that if there's a mistake, we find it sooner? This is the Bayer Essure product right here. These are coils that are put in a woman's fallopian tubes, and they're sold as being non-surgical, so they do not have anesthetic. It's in a doctor's office, and it's sold as being a permanent birth control, and it's often sold to women who have just had what they wish to be their last baby. But some of these women are awfully young. It's the same company as Bayer aspirin. And I went out early in May to join the Essure Problems women as they were rallying in California. And you can see that they have graduated from these sweet little shirts with the stars and Essure to piss on Essure and ACOG profits from broken vaginas. Essure cost me my reproductive organs and perforated my bowel. She's back in the hospital again. We think with C. diff, possibly. So it just goes on and on and on. So if you think anybody's even considering Essure, I have a t-shirt for them, and I'd love to pass it on. There are 1,700 harmed women on the Essure Problems Facebook page. We've saved a number of women by explaining to them what this is. The doctor's offices have fancy pamphlets in every office. They're handing them out. Bill and Melinda Gates Foundation, is doing like a global thing, helping women with reproductive issues. They have been
Pushing Essure?
Planned Parenthood, some Planned Parenthoods, and I'm a big proponent of Planned Parenthood and having plenty of options.
Planned Parenthood's
Regina, pardon?
1 minute.
Okay, 1 minute. Okay, so be careful what you wish for on reproductive options. So anyway, I will go surgical mesh. There are 78,000 women waiting in Charleston, West Virginia right now, federal court, and they have surgical mesh implanted for prolapsed uterus or stress urinary incontinence, and they are in pain. And what I was going to show you, do I still have it? Yeah. Hand this around. This is the same kind of material that surgical mesh is made out of, polypropylene. This comes around oranges, and in England, they were able to do a proposal for this, and it passed through the European system. And they're supposed to be even more stringent than the FDA. They looked at it and they go, yeah, that would work in a woman's body, no problem. So let's see. Dr. Human Nurchasm in The Power of Morse later. I don't know if you've been hearing about that, with hysterectomies, his wife, who's also a doctor, they have 6 children, and she had some endometriosis. Thank you.
And they gave her a hysterectomy using a Power of Morse later. She had
chopped it up,
early uterine
which you cannot detect ahead of time.
It aerosolized in her abdomen with uterine cancer and made her very, very sick.
Yeah. So anyway, yes, there's a lot to be inspired by. I love Safe Patient Project for Consumers Union. PCORI I'm kind of cool on because they're not doing medical device comparisons, and they're pretty much avoiding me, although I have donated some of my time. Public Citizen's doing a great job. Patients Included, absolutely. Regina. There have been a couple of movies that have been great about talking about the dangers. And this one is kind of on reproductive issues, pushing a little bit more on options that I think are not as safe as I wish. Ebola, that's been an interesting thing. But let's see. Anyway, I did go to 2 trials for surgical mesh, and one woman the verdict was for $1.2 million, and the other woman was for $73 million, and this was in Texas. Boston Scientific and Johnson & Johnson produced the 2 kinds of surgical mesh, and it came out that the polypropylene that's in there is a petroleum product, and the material safety data sheet that OSHA requires said it's not for implantation in human bodies. Boston Scientific, we went through the discovery and found that what they did was they put up a dummy company that would buy the polypropylene and then would sell it to Boston Scientific. Everybody was aware of it for over 10 years. And even in Dallas, where we're quite conservative in Texas and very rah-rah pro-business, they were reviled by the kind of business that Boston Scientific thought they were doing. So anyway, what I'm fighting for is the UDI, the Unique Device Identifiers, which hopefully are going through now. We want to vote as patients on those panels at the FDA. We want to have a warranty on all implanted medical devices. Let them have some skin in the game on the product itself, not on the surgery. But if the product turns out to be a toxic product, they should have to guarantee it. We don't want to have to go to federal court on this. State courts are just fine, thank you very much. And the FDA doesn't. Oh, and the trials that I went to, the judge said, we're not even going to talk about the FDA because we know it has nothing to do with safety and effectiveness. How's that? And we want something like Consumers Union. This is about brokerage firms. And Consumers Union does this. It ranks them. I want that for implanted medical devices. So let's see. This is me. I would love any and all responses from you. Really, any way I can improve my delivery, the information that I give to people. Criticism is fine, and that's how you get a hold of me. Thank you.
Great, thanks.
Thank you, guys.